Senior Source is brought to you by Synergy Home Care, Intrepid Home Health, and Southeast Texas Cardiology Associates.
Welcome back to 12 News Now on KJAC. Dr. Rudy Sotolongo from Southeast Texas Cardiology Associates Vascular Center and Vein Clinic is here today for our weekly Senior Source segment. So good to have you here.
Thank you for having me.
So today we're talking about an important disease. It's called venous disease. Let's talk a little bit about what that is.
Venous disease is diseases of the veins, primarily of the veins of the lower extremities. And there are two types of venous diseases, venous of the superficial veins and venous disease of the deep veins. And we're primarily discussing today the superficial venous system.
Okay, and what is that? Let's talk about that.
The veins that return the blood back to the heart that are near the surface of the leg. And the primary illnesses that involve them is venous insufficiency, where the little valves don't work. Once the blood returns back up to the heart, there are one-way valves that are there to prevent the blood from returning back to the leg. When the valves are abnormal, the blood returns back down to the leg and cause reflux of blood, causing enlargement of the veins and varicose veins.
And so if someone has venous insufficiency, they can come visit you, and how is that treated?
First of all, we do an ultrasound to diagnose it properly and determine the presence and the extent of the venous insufficiency. If it warrants treatment, it's done as an outpatient procedure where we numb up the leg a little bit and pass a laser light and do a laser procedure which closes the superficial veins that are incompetent and reroutes the venous flow back through the deep venous system.
Okay, all right. And so a lot of times people get confused too between varicose veins and spider veins. Can you tell us the difference between the two?
Yes, varicose veins are when the little valves, the one-way valves, are not working properly and the blood is refluxing back into the leg down. The little spider veins are just small, tiny veins that are broken on the surface of the skin, which have no real significance other than the cosmetic aspects of it.
And let's talk about that, the cosmetic aspect of it, because a lot of times when people have these, they're maybe embarrassed by it or they want to get rid of that. How can you help them with that?
What we do with those is we primarily inject them with a little medication with a tiny, tiny needle and basically make them go away. It's a very safe, simple, and outpatient procedure as well, which we also do.
All right, sounds good. And so if anyone has any questions, they can contact you. How can they do that?
Yes, they can just contact our office at 409-832-8862 and reach out to us.
Sounds good. And you also have a website, setxveinclinic.com.
That's correct.
Okay, so you can log online to get more information, or you can call the number on your screen, and his staff will be glad to help you and get you scheduled with an appointment if you need to see a doctor. Thank you so much for being here with us.
You're very welcome. Thank you for having me.
You're welcome. Stay with us. Jeff.